Bladder cancer is the sixth most common cancer in the US, with approximately 80,000 cases diagnosed annually. And typically the average age is over 55. Typically the options depend upon the stage of disease. And so the stage of disease is usually dictated whether or not it's penetrated in the muscle wall of the bladder. And so if it's superficial, or it's not very deep, oftentimes bladder cancer is treated with just removing the tumor from within the bladder with scopes. And so there's no incisions that are made. It's very minimally invasive in that way. If there is further penetration to the muscle wall, then there's additional treatments that are required, which range from getting chemotherapy and eventually potentially removing the bladder. There's two different ways of removing the bladder. Traditionally, a lot of people do it open, which means that there's a large incision that's made. I have a lot of experience removing the bladder robotically, which is minimally invasive surgery, using small keyhole incisions and using a surgical robot to do that surgery. So why Overlake? Overlake has a very comprehensive approach to treating patients with bladder cancer, collaborating with the Fred Hutch medical oncologists, radiation oncologists, as well as our support services, which include cancer survivorship services that we provide for our patients. There's just a very good multidisciplinary, comprehensive cancer services here at Overlake for patients with bladder cancer. Patients will often be nervous and worried about getting back to their normal lives. I actually have a patient who had bladder cancer at a very young age. He was actually in his early 50s. Very active man, worried about getting back to his normal activities. And fortunately, he's I think about 4 or 5 years out now. And he's back to doing everything he was doing before. He's traveling, he's going on cruises, he's swimming, he's skiing, he's mountain biking. What I really like for patients at Overlake with bladder cancer is that everyone here will take excellent care of those patients and make sure that they're well cared for and supported from the beginning to the end of treatment and beyond.